The Swedish Maternal and Fetal Specialty Center offers a wide variety of ultrasound services. So we can provide services from anything as basic as establishing the proper ultrasound dates for your pregnancy and giving you a due date, to doing special screening for chromosome abnormalities. And those are done both earlier in the pregnancy, around 11 to 14 weeks, and then later on in the second trimester as well, where we do a detailed anatomic screen and look at detailed anatomy and look for secondary markers of chromosome abnormalities as well.
What sets us apart in the performance of ultrasound is that in many centers, if someone's performing an ultrasound, they're not necessarily taking care of that pregnancy. In our clinic, we provide comprehensive full care, meaning that not only do we do the ultrasound, we also follow up on the ultrasound result, and oftentimes are responsible for taking care of any implications of what we see. So we really pretty much do it all, and ultrasound is just one part of the clinic as a whole. The range of ultrasound we offer is anything from a basic ultrasound to more complex assessments. A basic ultrasound would be assessment of the baby's anatomy, assessment of the baby's growth, and checking on the placenta and the amniotic fluid and making sure they look normal. All of our machines are equipped to perform 3D ultrasound. It's an important modality to help look at the baby's surface anatomy, and if we do see any fetal abnormalities, it helps us assess that in more detail. It also gives parents an idea of what their baby may look like if they do have a baby that happens to have a birth defect.
If there is a problem with delivering early, or the patient being at risk for delivering early, we often pay attention to the cervix, and we do a special kind of ultrasound where we put the transducer into the vagina of the patient, and we look very closely at the cervix for any early changes that might put them at higher risk. We also look at the placenta as one of the targeted areas that we can evaluate. When a patient comes for an ultrasound at our clinic, they will check in at the front desk. A sonographer, who is the person that will be taking the pictures, it's a technologist who's specially trained in ultrasound, will come and get them and bring them to a room. If everything looks okay, you go on to your next appointment. I feel so lucky that I'm able to connect with a team of outstanding doctors and provide the best care for patients. I am so proud of our team, and I love my role in it. I wouldn't trade it for the world.